Good evening. A major new investigation has revealed that women across the UK face systemic discrimination within the healthcare sector, igniting concerns about what campaigners are calling medical misogyny. The investigation highlights widespread delays in diagnosis for conditions such as endometriosis, as well as persistent dismissal of women's symptoms and chronic underinvestment in female-specific health services. Researchers say these failures reflect deep-rooted gender bias, with women routinely reporting that their pain is minimised or misunderstood by clinicians. Experts warn that the problem is being compounded by emerging technologies. New evidence shows that artificial intelligence used in diagnostics and treatment planning reflects long-standing gender data gaps, which risk biased outcomes for female patients. Legal scholars argue that current UK and European regulations do not do enough to protect women from the algorithmic discrimination. Campaigners say these findings must trigger a turning point. They're calling for dedicated women's health hubs, greater investment in research, and reforms to ensure medical training fully addresses female health needs. The government says it is committed to improving women's healthcare, but critics argue that without structural, sustained change, women will continue to be failed by the very system designed to care for them.
Good evening. Today, the UK's Department of Health and Social Equality have announced that medical misogyny, once a defining barrier to women's well-being, has been largely eradicated. Following a century of targeted reform, feminist design intervention, and major technological restructuring across the health sector form. The landmark assessment credits the transformation to long-term adherence to principles rooted in the earliest 21st century push for gender equality, including the UN's Sustainable Development Goal number 5. The late 2020s introduction of women's health hubs laid the foundation, but it was mid-century integration of feminist design ethics, known then as FemWork, that proved decisive. These principles reshaped everything from AI diagnostic systems to clinical training standards, ensuring that technology and practice were built around inclusion, care, and intersectional representation. Imaginative, speculative design initiatives, originally developed in universities and activist communities, were adopted nationally in the 2050s, prompting health institutions to ask not only how to treat patients, but who their systems had historically excluded. As a result, algorithmic bias has fallen to near zero, and conditions that once took years to diagnose, such as endometriosis, are now identified within minutes by transparent, gender-balanced datasets. Campaigners caution that continued vigilance is needed, but many argue the UK now stands as a global model for how feminist imagination can reshape the future of healthcare.